So Dr. MacPete, one of the things that's changed, I think one of the things we do so much better now than we used to is monitoring,
Yes.
right? There was a time, when I was a resident, that really the only reliable piece of data we had was owner perception. If the owner thought they were doing well, that was actually better than some of the tests we were doing in the hospital because the pets are just so different in the hospital. Since you've been doing this, what has changed and how do you feel that home monitoring has changed your practice?
Well, home monitoring has really been a game changer, like you said, because it enables us to see what's going on and get actual data with the pet when they're in a home environment, when they're relaxed, they're not stressed, when they're going about their day as they normally would. And so with their normal level of exercise, everything being the same, a lot of times if pets come in the hospital, they don't eat the same amount of food that they would because they're nervous or they're stressed. And you talked about this earlier, but cats in particular get very stressed in a veterinary setting, and so we're just not getting as reliable of data as we would if we're doing it at home. And home monitoring allows you to get this accurate data, but also it's really helped us prevent complications. It's really allowed us to fine-tune diabetes management and avoid serious complications that would happen otherwise.
So monitoring, clearly we're talking about measuring blood glucose, but what else do people do? We'll get into that. What else should people be looking at when you want to ask them, how is Spider doing? What should be incorporated in Ozzy's answer to that?
Well, not just, so we want to look at blood, obviously. We want to look at urine, too. So a lot of times we actually have people looking at their urine and getting a urine dipstick and looking for glucose in the urine.
Okay.
That's an easier thing for people to do as well. And then we also have them looking at clinical signs. You mentioned that that's what we used before. We still use that, and that's still a very important tool for us. How is the pet doing? Is the pet still drinking a lot of water? Is the pet still urinating frequently, having accidents? How is their weight? We have people look at their weight as well, their activity level, and their overall behavior. Those are all really important parameters for us to have pet owners keep track of and record and tell us about.
Tell me about this record. So how do they record?
Well, we like people to keep a diary or a log, so of all of these things. And a lot of times your veterinarian will give you this, and it'll be a log that you're going to keep track of that has dates and times. And so you're keeping track of, like I said, their weight, their behavior, how much they ate, when they got their insulin, and then any home monitoring that you're doing. So checking urine or blood glucose, those are going to be recorded on there. And then that data is given to your veterinarian weekly, or depending on the pet, it may be less frequent. But in the beginning, we're going to want to look at that weekly to see how well controlled the pet is and what we see with those clinical signs as well as the home monitoring. And
when do you do this in your practice? So initially, it's all about giving insulin, right?
Yes.
They kind of get over that. They're coming in to see you relatively frequently, and now, oh, by the way, I also want you to draw blood at home. How do you have that conversation?
Well, I do let people know in the beginning that part of diabetes management is obviously insulin, diet modification, weight loss, exercise, and home monitoring. But yes, I don't go into the detail till we get everybody comfortable, unless, sometimes people ask, what does that mean? What do you mean home monitoring? And so we explain that it's not scary, that we're going to talk to you about it, but it's not something they start right away. Again, initially, the pet is usually hospitalized to get the insulin started, and they might be in the hospital for 24 to 48 hours. Sometimes, depending on the pet parent, the animal can go home right away, and the pet parent can do the monitoring, depending on who it is and their level of comfort. But usually, the monitoring is going to start maybe a week or two later. And then we talk to the pet parent about what home monitoring involves and why we want them to do it, why it's so important. And I think most people, when they understand why it's important, and there's 3 major advantages to home monitoring, when they understand those, they get on board. They're really, interested in doing it.
And how do you explain those?
Well, I think the first thing is that we let people know is that we're getting more accurate data. So by getting accurate readings of the pet's blood glucose when they're at home, that information can be relayed to their veterinarian or their veterinary team so that we can more appropriately manage their pet's diabetes and make decisions about whether we need to change insulin levels or not. That's the first thing. The second thing is that we talk about the fact that it also helps us pick up serious complications. So home monitoring allows the pet parent to, if they think their animal is off, if they're worried that their animal seems wobbly or drunk or anything like that, they can do a spot blood glucose test because we're going to teach them how. So
and maybe even a urine too.
Yeah, or even urine, because we're empowering them to do that. So by having this tool, by being able to do that and be part of the team, the healthcare team, they are able to pick up life-threatening low blood sugar. They may be able to pick up the opposite. They may be able to see a trend where they're seeing really, really high glucose, or they're seeing something called ketones in the urine. So all of those things enable them to help us pick up complications that can be serious. So that's the second thing. And then the third thing, that's also very valuable, is that it decreases time and money and stress. So by doing home monitoring, they don't have to come in and see me as often, and that's less stressful for the pet as well as the pet parent. Saves them time and it saves them money. So it's really a win-win from those three things as to why we want to push home monitoring.